Hello and welcome. As we mark Pride Month, we have with us a very special guest, Dr. Sakshi Mamgain, founder UTH, which is the United for Transgender Health. Thank you so much, Dr. Mamgain, for joining us. We would like to tell our viewers, Dr. Mamgain is a practicing physician and a passionate advocate for queer and trans health who firmly believes that healthcare equity is a human rights issue. She started UTH, an organization based out of Dehradun, India, with an aim to make healthcare non-discriminatory and accessible for the transgender community, while also focusing on the mental well-being and the rights of the LGBTQIA plus community. In this special interview, we will be talking about the challenges in India when it comes to healthcare needs for the community and how to tackle the challenges while ensuring no one is left behind and health is accessible to each and everyone in the society. Thank you so much, Dr. Sakshi, for joining us today.
Thank you for having me.
To begin with, I would like to ask you, in fact, these hard-hitting facts that according to the National Human Rights Commission, there's an estimated 104 million Indians, which is about 8% of the total population, who are members of the LGBTQIA plus community. Despite this huge number, the access to healthcare still remains a challenge for the community in India. Dr. Mamgain, what are some of the areas where the big gaps still exist in our country?
Yeah, firstly, this huge number in itself is a gross statement and misrepresentation of the community at large. There's a 2022 nationwide survey in the US, in which nearly 20% of Gen Zs identify as LGBTQIA+, with Gen X or the boomers before them, or even to a large extent the millennials. A lot of things like safety concerns or social or religious factors, internalized homophobia or transphobia, or even just a general lack of visible role models in society, in media, in mainstream culture, potentially weigh in and sort of serve as a reason for people to be unable to truthfully engage with a survey of this sort. So in my opinion, that figure is far from the truth.
Okay.
Still, when it comes to gaps in access to healthcare, the first red flag, I think, is how queer and transgender health is completely excluded from the curriculum in medical schools, at least in India. I think very recently, there was also a lot of homophobia and transphobic literature in standard textbooks. So the doctors are not trained to cater to population-specific needs of the community. There's just a general lack of awareness and sensitivity among us. The stigma and discrimination, again, is so deep-rooted in our social fabric that more often than not, it finds its way into clinics and hospitals. Yeah.
Absolutely. And I think from the numbers, what you said, from the number is way more, and it's still a taboo. The discrimination is so much. But if I specifically ask you the infrastructural gaps, when it comes to healthcare system, in terms of facilities, in terms of the medical professions, when it comes to catering to the healthcare needs of the LGBTQIA plus community, are there any WHO, World Health Organization set parameters in this regard that India needs to match up to?
There are, unfortunately, even globally, there's not been much progress, but there is a global organization called WPATH, which has set guidelines that the entire world has to follow more or less. Again, when it comes to India or the structural organizations here, or just the systems in place here, there is a lack of LGBTQI plus inclusive policies and guidelines. So clear policies that could promote inclusive practices, non-discrimination and respect for gender identity and sexual orientation are necessary to just sort of ensure that seamless flow, to ensure equitable healthcare access. Yeah.
Okay, and also given, Dr. Mamgain, given that the LGBTQI plus community is diverse, right? And the needs of the transgender may vary from someone who identifies as a queer. Can you help us understand some of these differences and the nuanced approach that is needed to understand the requirements of this community and also to sensitize others about it?
We at UT envision a world where patient care is inclusive, non-judgmental and non-discriminatory, but to develop such healthcare services we need concerted efforts from multiple stakeholders. We can't just be working at a micro or like a meso level of framework. And it's also like high time that we jolt the macro systems out of sleep. So in my opinion, again, it is absolutely vital to provide comprehensive training and sensitization programs for healthcare professionals on LGBTQIA plus specific healthcare issues. As long as we don't include this as part of our education, we will still be churning out professionals who are not culturally competent.
Okay. So I think, initially, right now, the first challenge still really is awareness. The basic thing of awareness, sensitization obviously comes along with this, education. But just talking about the challenges in India when it comes to the aftercare, post or pre-surgery for transgenders.
As with any surgery, I think a part of the prognosis depends on care that is provided for the patient outside of the operation theater, on their bedside, at home.
Yeah.
Needs are accommodated at their workplace, or even if the medical expenses are covered by insurance. In India, there is limited access to specialized healthcare providers, so there's just a scarcity of doctors with expertise in transgender-specific healthcare.
Okay.
And of course, those that exist are only accessible to patients who can afford them. Generally, again, there's also a lack of standardized guidelines and protocols, and the absence of such can lead to inconsistencies in care and hinder the provision of adequate support during the recovery process. That's post-op. Yeah.
Okay, so huge gap, and I think you put it really well that it's like any surgery, one needs that special care, but of course, it needs to be more awareness and sensitization on this and how it should be handled. Dr. Mamgain, what is hormone replacement therapy? And how easily accessible is it in India? How easily available is it in our country?
Hormone replacement therapy is just like a medical treatment that involves, the use of hormones to bring about desired changes in an individual's secondary sexual characteristics, or those that you can see, those that are visible to the eyes, such as those related to gender identity or puberty. And actually is commonly used by trans individuals as part of their gender affirming care. It is actually works on the same principles as you would treat a postmenopausal cisgender heterosexual woman. But in the context of trans health, HRT typically involves the use of medications such as hormones like estrogen or testosterone, and an individual align their physical appearance with their gender identity. It's just that the process of getting to it has a lot of obstacles. So first you go to a psychiatrist, you obtain a gender incongruent certificate, and once you have that, typically it takes like 2 gender incongruent certificates to then go to an endocrinologist and have access to these hormones. Unfortunately, because of this, most people, especially people from the traditional Hijra communities, resort to and have to resort to easy access over-the-counter birth control pills. And when unregulated, they can have potentially fatal medical complications. So it's just all about the system.
So it's even more, it's obviously more dangerous.
Yes, absolutely.
So, like they say, like half knowledge is, so it's obviously risky. How difficult and expensive, you've spoken about the treatments, the surgery, but how difficult and expensive are treatments specifically needed by LGBTQI plus community? And how can this be eased and, again, made more accessible for more people who need it?
I think it's not about painful or expensive. It's just that other than the entire healthcare system being grossly understaffed, and again, the kind of specific care that is provided only being exclusive in terms of the socioeconomic strata that they're catering to, again, because of the affordability bit. Mostly, it's just that there aren't enough trained professionals who could take it all up on their own, like take the entire responsibility. It's a huge nation. And of course, there are a lot of people from the community who need tailored care. So it's just that we need to be sensitizing absolutely everyone who's providing healthcare.
Yeah, absolutely true. Dr. Mamgain, apart from the physical well-being, the other important aspect which we all have, I think, become more aware of, more conscious about during the pandemic is mental health, mental well-being. How huge is the challenge of ensuring mental health and well-being for the community?
When it comes to mental health, the LGBTQIA plus community at large, faces a lot of challenges due to societal stigma and discrimination, minority stress, and the entire spectrum. Statistically, we have a higher prevalence of depression, anxiety disorders, suicidal ideation when compared to the general population. The same factors actually also contribute to a higher risk of substance abuse in the community. We need to understand that mental health is delicate. So not every therapist or psychiatrist you see is an expert on the entire world of mental health. So again, we need mental health professionals who are equipped to provide proper care to the LGBTQI plus community specifically. Understand that your goal is to help the person, not project your beliefs on them. Their lives are not your lives.
No, I think that's very well put. Just a last question, Dr. Sakshi. We talk about health being a basic right for everyone when we say health for all. If you had to set the agenda for ensuring health for all for the LGBTQI plus community, what are the 5 things you would prioritize?
My foremost, I would like to go with education. We need to be talking, we need to be making more noise, we need to be sensitizing future generations of doctors. We just need to be engendering an entire community that is sensitive to the needs to the people that we're catering to, at this day and moment, we are not prepared. So most of the consequences of inadequate healthcare are because we lack training. It's a systemic failure. It's not just, you can't just put blame on the doctor. You can't just put blame on society. It's also like the macro systems at play when it comes to, let's say, the regulatory bodies when it comes to medical education or medical colleges. So it's just a lot of things that play a role here. Other than that, I think I would also like to clarify that I myself am from the community. I identify as queer and non-binary, so I understand I'm at both ends of the medical thing and the community. So patients need to place a little more faith in their doctors. I understand that we are lacking. I understand that we still have a long way to go. We have decades and centuries of harm to remedy, but we're trying to work towards a better system, towards a better society, and we're trying to cater to our patients. So just a little bit of patience and a lot of robust efforts maybe could possibly get us there. And we know that it's a long, long road ahead, but we'll make it. We just have to keep going.
Thank you so much. It's, I think what you've spoken, when we really talk about health for all, the way you've put everything across, I think something as basic as awareness, sensitization, education, and really bringing about the change for all so that we can ensure that no one is left behind. Thanks so much, Dr. Mamgain, for speaking with us.
Thank you.